Dr. Felipe Albuquerque is an interventional cardiologist with Holy Cross. He recently participated in the Cayman Islands Heart Fund Heart Symposium, and he joins us now to tell us a little bit about his talk that night. The talk was titled Structural Heart Revolution. Thanks so much for joining us.
No, thank you for having me. It's such an honor and a privilege to be here. Thank you.
So, first of all, when you hear the word revolution, this sounds exciting.
Right, yeah.
Can you tell us, what is structural heart disease?
Sure. So structural heart disease, it's a new area and a new field in interventional cardiology that focus on treating the valve abnormalities, okay, excluding the vessels, excluding the coronary disease. And over the last few years, there has been a lot of advancements on that field.
Why is it new?
Because traditionally the valve abnormalities of the heart, they were treated with surgeries, with open heart surgery. So patient had to stay in the hospital for a good 5-6 days. And then with the development of the technology, now we have minimally invasive options to treat valve disease, which the patients don't require to have their chest open, and they don't need to stay in the hospital for several days recuperating after surgery. You know, they can go home pretty quick, sometimes even on the same day and sometimes on the following day.
That is a massive difference, considering how aggressive that would be to actually have to open up someone's chest. So when we're talking about valve, are we talking about leaky valve, prolapse? What are the different?
Yes. So initially, the structural heart field grew initially around 12 years ago. With the development of transcatheter aortic valve replacements. Okay, and those procedures initially started in Europe, in France, and what it stands for exchanging the valve, okay, placing a new valve in the heart without having to open the chest, and everything is doing inside of the vessels. So the valve would be implanted by growing from going from the groin,
okay, rather
than opening the chest.
Okay. What are the risk factors, I guess, associated with having some sort of structural heart disease or some sort of valve disorder?
So there are several. Okay, the main one are the main cardiovascular risk factors. Okay, which is hypertension, obesity, diabetes, high cholesterol, lack of exercise, not appropriate diet. Those are the main ones. And patients, when they get older, they tend to have a lot of worsening valvular disease as well.
Okay. And how is it diagnosed?
Primarily, initially, patients present with shortness of breath. They can present with chest pain. They can have palpitations, feeling their heart racing, or they can even pass out. They can develop lower extremity swelling. Okay, those are usually associated with leaky valves, especially the mitral valve. However, on patients with aortic valve disease, the most common symptoms are chest pain, shortness of breath, and passing out episodes.
When do people need to see a specialist? Because I think sometimes we all sort of ignore little things. So when is it a big thing, or when do they need to go and really seek additional help?
So the severity of the valvular disease are pretty much classified in mild, moderate, and severe.
Okay.
It's recommended that the patient start to see the specialist when it's on the moderate range.
Okay.
So if you have moderate aortic stenosis or if you have moderate mitral regurgitation, it's time for you to see a cardiologist and a structural heart specialist right away.
And the outcomes, it just sounds like, things have really advanced, so the outcomes are really positive.
Yeah, so the outcomes have been very impressive. The technology in the field has grew a lot over the last 10 years. Patients are able now to be discharged on the following day after the procedure. The recovery is a lot faster, and the complications are a lot lower than before.
That's very good news.
Yes.
If there's one thing you'd like people to take away for those who came to the symposium and heard your talk, what's one thing that you'd really like them to stick with them that they take away from that? Yeah,
so the main points of the talks are, first, patients with aortic valve disease, okay, patients who have a condition called aortic stenosis, which is the tightness of the aortic valve. If they are young, if they are in the 40s or in the 50s, surgery may still be the best option for them. Okay, however, once they reach the 60s, the 70s, and the 80s, and they're considered high risk for surgery, there are several options now available, okay, especially doing the transcatheter aortic valve replacement.
Okay, so that's really good news.
Yes.
Thank you so much for joining us. Really fascinating work that you're doing, and we appreciate you sharing that with the Cayman Islands.
Thank you so much. Thank you for having me.
Thank you.
Appreciate it.